everyone, thanks for watching this video. This is going to be my baby's 2-month update. Got a lot to go over, so if you're interested in finding out all about it, keep watching. Okay, so let's jump right on into the date, December 23rd. I consider my baby to have had a TET fit, or a TET spell as they would say. He has tetralogy of Fallot. I mentioned about that in my last video and posted a little diagram all about it. He has a few heart defects. He got very, very mad at me, and it took me about 2.5 minutes to calm him down, and he was a very dark shade of purpley blue and holding his breath, and I got him calm and he was back to color and he was sleeping peacefully. And then I broke down for about 45 minutes in the kitchen on the floor, just hysterical because it scared me. I don't like the feeling of not being able to save him if something were to happen. Now, saying that, me and my husband did take a CPR class, and we have a doll, a blow-up baby CPR doll. We have a video that I can constantly go over, but I struggle with anxiety as it is, and I do not do well at all in emergency situations. I freak out. I am not calm, and it was very, very hard. So because of that, after I calmed myself down from his TET spell, I of course I texted my son's cardiologist and I talked to him about it, and he said to drive him back to the hospital and have him admitted through the ER. So we did that. He was admitted overnight. Of course, they swabbed his nose for RSV and the flu. I guess just standard stuff that they do when babies come in the ER. And started an IV. Don't mind my 19-month-old walking around with cups of ramen noodles behind me. So after a night of monitoring him, his cardiologist decided to start him on some heart medication called propranolol. I'll put it right here. And it's just to help him not have TET spells, hopefully, until the date we were hoping to have his heart surgery, which he's still just barely a month old at this point, and we were aiming for between 4 and 6 months of age for his heart surgery. Okay, so the next day, which was Christmas Eve, which also is my birthday, we were still in the hospital, and we were told he could go home, spend Christmas and the holidays with family, and we just needed to wait to be discharged. So our awesome cardiologist, who was on family vacation for the holidays at Great Wolf Lodge, over an hour away from us, left his family for a few hours to come to the hospital and discharge us so we could go home. So that was pretty awesome of him. We love our cardiologist. The rest of December was pretty uneventful. We didn't have anything major go on. Sullivan was doing really well at this point. Let's fast forward now to January 7th. We had his follow-up urology appointment. We were there, and he did the ultrasound, and it looked like he had quite a lot of stool built up, and as well as a lot of urine in his bladder. It was completely full, and I didn't understand why, because he was going to the bathroom very, very often. Every diaper change, you know, And he said, the urologist said that, well, he has 2 kidneys, and if one wasn't working right, the other one would still produce enough to make you think everything was fine. So they did a urine sample, or they took a urine sample from him. They had to insert another catheter to get that, just to make sure something major wasn't going on. They went ahead and started him on an antibiotic called Bactrim, and he was to take that once a day. And it was just kind of as a precaution to prevent anything from happening. He did say that it looked like one of his ureters wasn't connected properly to his bladder, but he didn't seem very concerned about it. He said, we'll wait to see what comes back with the urine culture, and we'll go from there. He had a slight temp. It was just over 100, but he was also all bundled up in the car, and so I didn't think much about that either. The next day was a different story. So I forgot to mention, but they also wanted me to start him on some Miralax to try to clear the blockage that he had, and maybe it would make him feel a little better. So I was starting that as well as the Bactrim and his heart meds from weeks before. And he started to lose his appetite. And I posted on my Facebook, just to relate with other moms who have been through this, and a lot of them were saying the antibiotics could be causing it. I called the pediatrician's office. I didn't get to speak to his pediatrician. I spoke with the front desk lady, and I told her what was going on, what all had went on, what all he was taking, and I wanted to know advice. What could I do? Why is this happening? And she said that she took the note and she was going to take it to my pediatrician's nurse, and that she would get back with me. So this was first thing when they opened in the morning. So I waited, and I waited. And finally, around 4 o'clock in the afternoon, I figured it's getting close to their closing time, and I haven't heard back. What gives? So I decided to call back up there, and the same front desk lady was like, well, let me go check. She went, and she came back to the phone. She said the nurse hadn't even read the messages. And she said, but I went ahead and talked to the pediatrician, and they asked if you could come in the morning. And so I said yes, and it got to where he didn't even want to eat. And I was forcefully trying to get food into him. And the most he would take at one point was an ounce. And that scared me and worried me. So on January 11th, I was actually in the middle of getting dressed and getting the kids loaded up. It was about 8 o'clock. I received a phone call from the pediatrician's office saying my pediatrician wasn't there today for some reason, but they had a different pediatrician that could do the same appointment time if I wanted to do that. And I, of course, did. We saw this new pediatrician, and she, of course, looked him over just like it was a normal wellness check. He was weighed. He did lose a little bit of weight at this point. He was measured. She watched him drink. She inspected his mouth. She noticed he had a little tongue tie, but she also see him drinking a little bit, and she said his suck was good. Looked at his eyes, his ears, listened to his heart and his little murmur, and she said if it wasn't for that little murmur, you wouldn't even know by being around him that he is a heart baby. And she said, I don't know why he's choosing not to eat. She says, my advice would be to go to the hospital and get some blood work done and have him watched. She says, and so you could do that here, she says, in your hometown. She said, but if something comes back, because he is a heart baby, they may want you to go have it all done again up there. She says, so you could do that. She says, or you could go straight up there. And I said, well, I need to call and ask my husband. Before I could get a hold of my husband, that pediatrician stepped back in, and she said she just conversed with the urologist, and the urine culture came back with a few things in it that were concerning. Basically, they thought he had a UTI, which he did. And so she said that she was going to also call the cardiologist and see what they recommended. And she did, and the cardiologist on call told them to get me up to the ER, and they were going to start him on fluids. Because he is a heart baby, they were worried about him getting dehydrated, not drinking enough, and going into cardiac arrest. So I went from there to pick up my husband from work, went back to our house, packed us an overnight bag, got my 19-month-old situated with a grandparent, and we headed up to the hospital. And we went through the ER. He was admitted. He had an IV put in, and he had his nose swabbed once again for RSV and the flu, temperature taken, all of that. But because he did have a UTI, they did start him on the antibiotics there in the hospital, and plus a separate antibiotic. I do not know the name of it, and it was supposed to help clear up the UTI. He had to have a specific one for the specific something they found in his urine sample. And they did another heart echo on him, and his stenosis had gotten worse. It was at like 50%, they told me, and it had jumped to like 65%. And that was Sam. Thank you. So they were concerned about his heart. They also did another renal ultrasound to check on his kidneys, and they were both very dilated. His urologist came up bright and early in the morning to let us know he reviewed the ultrasound, and he was very concerned. And basically, he said that our baby boy would be having urinary tract surgery the next day. Turns out, our little boy's, one of his ureters was not even connected to his bladder, and the other ureter was connected, but not very well, had some obstruction. And so they think that's what caused the UTI, is he had all that going on, and he's drinking so much milk that it has nowhere to go. It's sitting in the bladder and causing all of this. So they were wanting to jump start and do this surgery, one, because the situation wasn't going to get better on its own. It needed help. And two, because his heart had gotten worse. And they were already thinking about planning his heart surgery very shortly after. And they wanted him to get better through recovery with this surgery before then. So that's what happened that day. Now on the 14th. It was a very intense day for, I guess, me and my husband emotionally, and baby boy physically. Although he did great. He did have his surgery scheduled for 1 o'clock, but before then he had to go through a nuclear medicine study, and kind of similar to a VCUG, but different somehow. And the machine was just massive that he went under, that scanned him like an x-ray. It was huge. I wish I would have gotten a picture so I could post it. But he went through that. He did not like that, and he went directly after to pre-op, and then into surgery. We left him with his anesthesiologist, and we were very emotional about it, and we were told the surgery would take about 3 hours. And out in the waiting room, they had a TV screen that would update you when your child had started surgery, or when surgery had started, and when it was finishing up, and when he was done completely and about to be wheeled out to recovery. And we were in there. It wasn't until about 2 hours after the scheduled time that it showed up that he was even going into surgery. And shortly after that, we received a phone call out in the waiting room from his urologist in the surgery room saying that he was going to change the surgery, and he told us what all he was going to do. We told him, do what's necessary. So he did, and the surgery took quite a bit longer. Baby boy went in at 1 o'clock, didn't get out of surgery till 6-ish, and we got to see him as they wheeled him out of the surgery area, taking him to the CHSU for recovery. So once they called us in to see him, we went in, we scrubbed our hands really good, and the room they took us in was huge, and he had 4 nurses personally assigned to him. He had a breathing tube. He was still, out of it because of the anesthesia, but his urologist said he was really, really happy with how the surgery went and that he did really well. Over the next few days, they were just monitoring him and taking different lines out of him one by one. He had, something in his neck. He had it in his arm. They took the oxygen off at one point. They had to do all of that before and see how he was. And finally, on the 18th was the day that he was discharged. They wanted to just be sure that he could go to the restroom by himself without the catheter that was in for surgery. And once he proved to be doing that, they said we could take him home. He was discharged. The cardiologist that discharged him recommended us to stay local for 24 hours just in case anything were to come up. And so we stayed in a hotel that night, and the following morning we got up bright and early and we headed back home. Really well. His eating was picking back up. He was taking between 1 and 3 ounces about every 2 hours at this point. His incision where the surgery took place is in the area kind of where a woman's cesarean would be, and it was all bandaged up, and I was told not to mess with it, that it would come off on its own. He finally turned 2 months, and he was weighing in at 9 pounds 3 ounces now and 20 inches long. He was doing really well. He enjoys to be propped up and look all around. He's very interested in looking at this point, and definitely a mama's boy, big into snuggles with mom. So that's basically it for his 2-month update. Quite a lot went on for a little guy, and his parents are real proud of him. He's our little fighter, and we are just so thankful for all of our family and friends that have prayed for our family and for our little boy. Definitely believe in the power of prayer. And our surgical team, the urologist and all the nurses and the cardiologists, they're all so awesome at the hospital that we're at, and we're extremely grateful to have such a good check back for his 3-month update coming soon.